Be sure to check your screen name and ensure that it matches how it appears on the roster. All right, we have about 10 seconds, but we'll go ahead and call official start time. Good evening to everyone and welcome to week 4. Hopefully everything is going well for you. And so, let's see here. The adaptive quiz, hopefully you saw the announcement. The adaptive quiz will be open after class tonight, and then you'll have until I want to say Sunday is what the announcement said to complete that. So just make sure that you are taking it in a setting that that's let that you don't have that many distractions because you will have that one setting. It is 25 questions. And so let me pull it up here. It is due on Sunday. So I know we last met last week. We were thinking we were going to take it in class, but which would have been different from what we've been doing with our other classes. So adaptive quizzes, you take it on your own, and it's adaptive to the way the answers that you're given, and so it builds upon your strengths. And then it pulls out those topics and concepts that you're not as strong on. So, but be sure to just make sure that you have a distraction free as possible setting when you actually sit down and take it. It will open up after class, but you do have until Sunday to actually complete it. And there is only one attempt on it. So just make sure that you have enough time and to complete it in that one setting. So that is how those adaptive quizzes will go. And then I don't know if you all have taken any of those 2.0 classes, but we've already converted to adaptive quizzes in those classes. And that's one of the things students take those on their own. Unlike prior to, like our quiz 2 weeks ago, we took, it in class. So you take it on your own, just to be clear on that, because that may be something new for you all. Like I said, we had already transitioned to that in several of our other classes. All right, so let's just remember, the NCLEX is your game for anything on all of your courses. So make sure that you're going back and looking at all of your materials, even, for your HESI, even though you've taken unit exam 1, still go back. I suggest chunking it up, not sitting down. Well, but whatever works for you, you can sit down in that one setting and just make sure that you are not putting that information away. Don't tuck it away. Continue to review, review, review. And so let's just recall on some of our concepts for week 1 and 2 and 3. So primary prevention. So if you would have to give one word, I just gave the word, but anywho, primary interventions, secondary, and tertiary. If you had to give one word, what would that be for tertiary? If what helps you remember, and if you need more than one word, that's fine.
Treatment.
Okay, so treatment. So now let's take that a little bit further. So give me some examples of treatments.
Like educating how to live with the disease once they already have the disease.
Okay,
So
so
to prevent the progression of the disease, to learn how to live with the existing disease, like
okay.
teaching how to use a glucometer or blood pressure.
So why is that not primary? You said educate about whatever that you draw on the line. It could be blood pressure
Because
monitoring.
they have the disease.
Okay. So some kind of way, mix that up, paraphrase it, however you want to. But education can also be tertiary. It is tertiary because the person has an injury or disease process, something already there. So test take your tip. If it's asking you about the different levels of care, write out, jot down, or recall, well, what is that? Define it. And then, like we just did, she said treatment. Then we'll give some examples and then match it. Because remember, in the next gen, they want you to be able to apply what you know. It's rarely going to ask you, well, what is tertiary? What is secondary? Okay, so now let's do secondary.
Also
Screening.
screening. Oh,
Okay, so now give some examples of that.
Mammogram.
Okay,
Colonoscopy.
colonoscopy.
okay. All right, so what about primary?
Prevention of the disease.
Education.
Mm-hmm. Education. All right. Okay.
Vaccination.
Okay. But what if we do a TB skin test?
That's already screening because you're TB is screening for the disease.
Okay. Good. All right. So the exams are big on those levels of prevention. Levels of prevention. Good. So just as long as you have a strong foundation understanding of what each level is, not only the definition, but some examples. Make sure you still know that. That's going to be on all exams. Those so that's not going to go anywhere. All right. So what if a patient, this is a scenario, and you just tell me what level this is. The patient has been diagnosed with let's see, call it something, has a broken arm. They fractured their wrist. And so the nurse is reinforcing or educating the client about cast care.
That's tertiary.
Okay. All right. So it's tertiary. Anyone that disagrees that is tertiary. And if you do, that's fine. Just let us know so we can fine tune, give you some more information about it. Anyone disagree? Okay. And the reason I started off with the different levels, because if you miss things, this is what was mostly missed. So that's why I'm just making sure that you have that strong foundation of like what primary, secondary, and tertiary is. Not only the definition, but we can pick out or know examples of that. Okay. And then let's see, what else was it? The levels of prevention. That was the most that was missed, those different levels. And not to say that's what you missed, but overall, as with all the classes combined, those levels of prevention was the ones that we missed the most of. So we're trying to keep safety, ABCs and safety, and then Maslow's hierarchy of needs. But when it comes to firearms, ABC, safety, what are some, you're going into the home, and so what is some information that we need to discuss or bring to the parents or guardians attention regarding keeping everyone safe in the home if there's a firearm there?
Isn't it keeping it locked up?
Okay, keeping it locked up. Is that different from asking about the locks, or is that the same thing?
Could be different.
It is different. So again, taking to make sure that you're stepping back and reading and making sure that you understand what the question is asking you, and also what the answer choices actually are. So, we're not for guns, we're not against firearms, but we do need to know, if there are firearms in the home, have they had firearm safety classes? How are they stored? what is the use of the firearms? Is it for recreation? Is it for safety? And therefore, we can kind of guide them on other resources besides just the gun safety classes. So if they need, they're actually using the firearm for hunting, there are some classes out there that are specific for that. So just make sure that we're understanding, well, why is it that this is in the home? Because it could be there for different reasons, safety and or just leisure. Okay,
I'm sorry.
so
I'm so sorry. So you just need to find out what they're using it for?
you do need to know that as
Yeah.
well, because remember, we want to ensure that everyone is safe, and even if they're using it for safety, there are firearm safety classes. Now, to take it a
Mm-hmm.
step further, if they're using it for leisure, and if they're just a new hunter, then they have classes specific for that.
Mm-hmm.
Mhm.
Okay.
So where they're stored, who's using them, where they're stored, making sure that the ammunition and the firearm is actually stored, separately, and then, have they been taught, or do they have the information they need to be safe? Everyone's safe in the home with the firearm. If the wife is using it, for hunting, have they taken hunting classes, or official or unofficial, sometimes your uncle or somebody, your dad can teach you, but just make sure that they really know how to actually use those firearms as well. So tell me about what do we know about the Individuals with Disability Education Improvement Act? That idea, but that's the acronym for it. What does it require schools to do? So think of it as
I'm sorry, can you repeat that, please? Individual disability.
Individuals with Disability Education Improvement Act. We call it for short IDEA, IDIA, IDEIA. So I think of it as like in the nursing home or the hospitals, we have care plans for our patients. But this particular act is implemented in the school setting. So what do we have for our students that might need medical care? What do we call those? Not a care plan, but a what?
IEP.
IEP, yes. And that act is where that IEP actually came from. So it's to me, it's the same thing as a care plan. It's just in a different setting. It's in a school setting. So that it requires schools to develop an individualized education plan, IEP, for children with disabilities. And a disability can be, we had a student who had broken their dominant hand? But anyways, he needed assistance. The student had an exam. The student had studied for the exam, but because it was his dominant hand, the student couldn't, fill in, the blanks or whatever, or actually click the computer or the device. So that individual plan, in that plan, it allowed extra time. It actually had someone to key or either write, whichever way. So it covered all the different classes. So that student still could continue with their education. And that's what that IEP plan is an individualized education plan where it's for children with disabilities. And it could be so much to say that this child has a broken arm, and that is the dominant arm. So they would need assistance with getting from class to class, taking their exams, completing certain projects. That child may need extra time. It's sort of like in college, the accommodations, but like I said, they're all the same, and it's specific to that student. It could be that the child needs 2 feet. So in that plan, it is that, as a school age child in that plan, they're allowed time to receive that 2 feet, Foley cat, whatever it is, that medical care that they actually need. So any questions about any of those concepts? But levels of prevention was a biggie that it's like those scenarios kind of trip some of you all of it. But go back to and I know you have a dry erase board, and for the most part, we use it for math. but it's a dry erase board. You can use it. So if you need to organize, jot down, but don't spend a lot of time if you can, a 1 word or 2 word to remember whatever the concept is. Because sometimes you do need to organize your thoughts. And so you can use that, your dry erase board for that purpose, not just for math. All right. So let's toggle on into week 4. So looking at our modules, we have, but overall, as an average, you all did really, really well. So we are in week 4. So you have a case study, and you actually have 2 case studies, and then you have that quiz. So that's what's due this week. And then we meet next week. We have NCLEX questions. And remember that list is posted in the announcement section. It was posted early on, so you'll know which categories to select. And then in week 6, so we meet this week and next week, and then there's a unit exam. So again, start looking at your schedules, adjusting things as needed and as you can. All right, so let's move on here. So when we send, and I'm just going to call out some concepts. I want you to just do some jot noting. And it doesn't have to be anything long and elaborate. When we talk about OSHA, I know you all have heard about OSHA. What comes to mind when you hear the word or term OSHA? Who is that? What do they do?
Sports.
And that's what comes to mind. Exactly. Work. It's like, okay, work, keeping people safe at work to ensure that people are safe, and that they have helpful, safe working conditions. And so that could be the difference between, and when we say keeping them healthy and safe, if you're in a setting and they're supposed to have a mat, and that mat is supposed to be not torn or a raggedy or anything like that, because if it is torn, that means that mat is not serving its purpose. And if that mat is keeping the nurse from slipping and falling, and so is it important to report that mat is torn, or is it not important?
Important.
It's important. Exactly. So when we think about work conditions, most of the time, we want to think about, patients being on precautions. Do we have the PPE? We doing hand washing, but it goes beyond that. That equipment that you're using. If you're in a setting where you're having to complete certain procedures and the equipment is torn up, not working properly, we don't need to just move forward and use that equipment. It needs to be, there's a reporting process, and that facility has to keep the person safe, to keep the nurse safe, and as well as the patient safe. And so, yes, OSHA, work comes to mind. It is Occupational Safety and Health Act. So, OSHA. So, what about, we went through the levels of prevention already. I'm just calling out some terms here. What about that triangle, that epidemiological triangle? What are the 3 parts of it? What is it about that triangle? We have something that's causing the disease. We have that person that's affected. And then we have the conditions that facilitate that disease transmission. So what are those 3 parts that represent that? So we know the person is the host, right? So what are those other 2 parts? What are the conditions? What is that called? It begins with an E.
The environment.
The environment, exactly. And then that pathogen that's causing the disease process is called the what?
The agent.
The agent. Okay, so they call it that epidemiological triangle. It has those 3 parts: the agent, the pathogen, the thing, the bacteria, the virus, the thing that's causing this person to be sick. And then the host is the person. And then the environment are those conditions which facilitate that growth of that person, that whatever that bacteria or virus or whatever it is, to continue to grow. So then that helps you know that triangle. It's like, why do we need to know about that triangle? But that triangle helps you to identify, like this outbreak, the lettuce thing, and then it's been outbreaks, all different types of things. The most recent one, is the that virus. What is it called? I asked you about last week what it was, but anyways, identifying the agent, the pathogen, whatever it is, bacteria, virus, spores, whatever it is, that's causing people to be sick. And then the people that's actually sick, and in those conditions, that environment, that helps to identify the source of the outbreak. And then once we do that, and so even if you're in the school setting, if so many people get sick in a certain date and within a certain time frame, we have to report that to the health department. And so doctor's offices, people, they're seeing a huge number of people coming in with stomach viruses, with the similar or same issues. Then those numbers go out to the troops. And then they come in and say, well, hey, I think we have an outbreak here. This is not just a run of a meal of people just haphazardly getting sick. Let's do some investigation. And this is a setting that you can work in as a nurse. You're going to be dealing with numbers. And so what they do is they say, well, hey, we have people, mostly from, whatever state, and they were, and they start asking those people questions. And you all probably remember this when, if you had COVID or you were part of that COVID surveillance, you had this huge sheet to go and ask people, like, where have you been? Have you been to a funeral? Who have you been around? Can you list those persons? Have you been to the group? That was asking all those specific questions. And then you take that data, and then it helps you to identify the source of the outbreak. Okay, well, where have all these people mostly have in common? Then the place, they're like, okay, well, what did all these people eat? What happened? So everybody was at restaurants. They went to the grocery. You have those few variants in there. People went to the grocery store. Some people didn't go get anything to eat, or they may have actually went to the grocery store and purchased an item. What items did they purchase? And then that's how you determine the source of the outbreak. And that's when you saw in the news where they were reporting, well, we have this many cases here. We're trying to find the source of it. And then they finally, said, well, hey, it is more than likely the lettuce. And then where did the lettuce come from? And then they track it back to, where did those places, the restaurants, the hospitals, all those different places, where did they buy the food item from? So we said all that to say, three things you need to know: that epidemiological triangle. What are the three things? You got the agent, the thing that's causing people to be sick, whatever that pathogen is, then the people. And then we have the environment, the conditions that facilitate that disease transmission. And why is that important? Because it helps us to identify the source of the outbreak. And then the next step is, well, how do we control this? How do we make this better? How do we prevent others from getting sick? Well, they was putting it on the news. You could hear radio announcements. They had different announcements, different places on different social media platforms and everything. And then, families and people started having conversations. And what happened next? People started looking things up. People were, once they realized the source, people said they made a choice. Hey, I don't want that. I don't want anything that has lettuce on it, or just don't put lettuce on my food. And so that helped slow down those outbreaks. Any questions about that triangle? We talked about OSHA, keeping the workplace safe, and no item, no, like I said, the mats, the blood pressure cuff, the lift, whatever it is that you're using, if it's in ill repair, someone needs to know about it. We need to pull that out of circulation. We don't need to continue, because what's going to happen is the nurse will actually get injured, and or the patient. So those workplace hazards, if you find something else that's not addressed, for example, a facility had a high rate of falls, not the patients, the staff. It was like, what in the world is going on? These people keep falling. And so within that facility, they did their own little investigation. Okay. What do you think they actually did as part of the investigation? What do you think? What information do you think they gathered?
They gathered the information from the people who had fallen about where they were, what kind of shoes were they wearing.
Mhm. Okay. So they checked out the people who had on, because you go to these facilities, it's a reason why they have a uniform policy. There's a reason why. Um, they say wear non-slip shoes. So they checked all that out. Different people, and then the place. People were falling in different places. Then they also identified that people did not fall, but a lot of people had tripped. So we had a huge number of falls by employees, and then people were saying that hey, I didn't fall, but I tripped a couple of times. So what else do you think they found out, or what other information, or what else did they have to look at to try to determine the cause of why this high number of employees were falling? What else do you think?
Maybe
I don't
the
know, maybe
I'm sorry. Maybe the environment, maybe it was the floor, maybe it was, something on the floor.
And what do you think that it was about that floor? So floors, they probably been there forever. So the floors are probably not in ill repair. But what about that floor?
What?
The floor. What about the floor? The
There
floors
could be
probably
Damaged?
they were not, for the most part, floors are not in ill repair like highways are. For the most part,
What?
inside of facilities, floors are good. But what? What were you gonna say?
What? What?
What'd you say?
they're wet.
What?
Y'all are saying it at the same time. I don't know. I can't really hear what you're saying.
What?
The janitors, they had found out that they had a new chemical that they were putting on the floor. The floors were beautiful, but what it was, it left a film on the floor. So the floors were slippery. And it wasn't in all parts of the facility, but they had to track it down. And this is a team that you might be working on in the facility as well. They call it sometimes they call it QA. But anyways, for the most part, it's focused on the patients, high rates of fall, medication errors and things like that. But you never know what end up happening. But they ended up looking at, okay, well, did everybody fall in the same location? No. Okay, did they wear what they were supposed to be wearing? They did. All the employees had non-slip shoes on. No one had the incorrect shoes on. And then it's like, wait a minute, what is it with these floors? Our floors are fine. Well, I forget how they said the conversation the start, but anyways, long or short is they found out they were using a new chemical on the floor to wax or buff the floor. And the it was leaving a film in certain places. So so that's just something. How now did they report that to OSHA? I don't know, but for sure they did have their team to sort out, to look and see what was going on, because it's, for the most part, you don't go to work and get injured. So, but nevertheless, OSHA is there, and no matter what the instruments are that you're using, if they're in ill repair, if you're noticing, hey, I'm tripping up. I have been tripping up, because it might not be what you think it is, but you want to keep yourself safe, is what I'm saying. So it's worth reporting, and you might be on that team that have to research and see why. Any questions about OSHA keeping us safe at work? Okay. And you should see those signs and things posted. We talked about the different levels of prevention. We defined what they were. We gave some examples. We talked about the triangle. We identified all the three parts. And then we talked about why that was important, because it helps us to narrow down and identify the source. If there's something that's making people sick, it helps us to narrow that down. All right, so that's just a good overview of where we're going. So CDC, what are they for? Let's talk about some of these governmental agencies. I'll pull up our PowerPoint here. What is the Centers for
Disease
Disease Control?
control.
What do they do? What are they responsible for?
Like for the outbreaks.
Exactly. So that might be a setting that you want to work in, but you're gathering numbers. And once those numbers gets to be a certain number, then they send out the troops, so to speak.
Yeah.
And go ahead. What were we gonna say? And that might be someplace that you're interested in working as well. Let me pull this up here. Let's look at the public health nursing field. All right. Just waiting on it to open up. I know what I wanted to do. Going back to, let me see, can I find it real quick? Wow. Hmm. So, how many of you all, you don't have to raise your hands, but did you go back and review our classroom recording? Did you go back and review our classroom recording? So make sure you do that. While we have so many different exam reviews, encourage you to attend what you can. Dr. LaMarie, she does her midweek, and she does share the recording. You can't go through that, but at a minimum, make sure that you go through the classroom recording. Okay, yeah, I want to go back through this right here because it's important that we make sure that we understand. Let's see, let's do the slideshow. And we're not going to go over all the slides, but go back to the first one. Not that one. Okay. So we gave you examples here. And remember with this tertiary, it does not have to be, it was a good example that you gave. It doesn't have to be medication, it can be education about. So that's considered as non-pharmacology. Okay. And then here we gave you some more examples. We talked about the community. You all did good on the community-based. You all were able to identify that the community-based was providing to that individual. You all did good on that. But nevertheless, I'm pulling this up to show you that, the information, we go over the information you all. Teaches self-blood pressure measurement for a newly diagnosed hypertensive patient client. So that's one person. So we were having a health fair that would include, a broader population. So that's community oriented. Okay. And then this community based, it could be wherever they're at. You can be at school, at the school nurse and teaching that patient, that student about their inhaler, but if you're working with that patient. Community oriented is like we're at that health fair and we're out there for a broader population. Okay, gave you some examples here, providing eye exam clinic for all members of the community, providing vaccinations for all members of the community, community oriented. We did talk about, the payer source. You all did good with that. Just want to go back through just to make sure I didn't miss any. Okay. Okay, I think that was it that I wanted to pull this up as I was reviewing anyway, so that you could just see what I was saying. Okay, Nurse Practice Act. Someone read this for me. This first sentence right here.
A
You want to
nurse
say it loud? Oh, I'm sorry.
practice act serves to protect the public by setting minimum qualifications for nursing in relation to skills and competencies.
Okay. With that being said, what is the purpose of the Nurse Practice Act?
To protect the public
Got it. How does it do that?
by setting the rules and regulations.
Exactly. It gives us our to-do list. That's how it protects the public by saying, hey, as a physical therapist, you can do this. As a physical therapy aide, you can do this. As an LPN, you can do this. As an RN, you can do that. It protects the public by clearly identifying the qualifications and the minimum skill sets and competencies. This was another one that you all tripped up on. But do you see with this explanation, do you see what the purpose is and then how it does that? Are we clear on that, or is that not clear what I'm saying? Okay, not hearing any, so pretty good. All right, just making sure. And we're taking the time to do this because it builds up on, doesn't go anywhere. I think that was it. Nope, nope. All right, so that's it. Let's move forward. Was there any concept that you thought about that was questionable about the on the exam? And of course, I'm not gonna put the question, but the concept. Any concept we need to talk about before?
There was one question I was concerned, like I didn't understand. There's something about, was it that somebody came to the US and how would explain the health care in the United States, like two parts, like was it private and do you know what I'm talking about?
Medicaid, Medicare?
No, it was like private, is it private pay, or it was questioned like somebody came to the United States, how would we explain the health system in the United States? Something like that. It was the question.
Okay, so we have two systems, right?
Two
This is the
systems, right? That's
public and
yeah.
private. So
Yes.
what falls under public? Medicare, Medicaid, VA,
Okay. So
and then
the answer was private and public. Right? Those are two systems.
those are the two systems.
Yeah.
Mhm.
Okay.
Exactly. Those are the two systems.
Okay.
It's public and private. And your
Okay.
another private is like the Blue Cross and Blue Shields, those type insurance companies. Those are not public. Those are private. People subscribe to those
Mm-hmm.
on
Mm-hmm.
themselves. Yes. Yep, it's public and private. And then
Mm-hmm.
to dial it down, you have Medicare, Medicaid, and people can be dual enrolled. Because remember, there's that I know end-stage renal disease comes to mind.
Mm-hmm.
Medicare is based on age, but if you have there's a few diagnoses, if you have those, you can also receive Medicare and you are not 65. Medicaid is income based. All of
Mm-hmm.
those are public, meaning that the government and the citizens, they help pay for that. And then the private are like the Blue Cross and Blue Shields. What's another private company? But there are several out there.
Like Anthem and stuff. Yeah.
Yes, exactly. Anyone else? All right, let's move forward here. Okay, so we're looking at the public health field guide. I'll share my screen here. Sure. All right, let's go. So the public health nursing ecosystem. So when you hear that, what comes to mind? What comes to mind when you like in what do you think about public health nursing ecosystem?
Mm.
So like who are we taking care of? And it's, it could be communities, and communities can be within a organization. When I say within an organization, it could be in a place of faith. It could be at the school, because you could be that school nurse. It could be at an industry, because we can work in we can work for the NFL. We can work for the industry that's making tires, shoestrings, or whatever. But it's the people, and then
Mhm.
to be more specific, is those they're vulnerable, children, because remember, the children are solely dependent on an adult to provide for them. So you always have the elderly and the children. They're going to be the most vulnerable. And then, but then if you have to choose between the older person and the child, it's going to be the child, because the child solely depends on. So with that being said, what I just said, who is most vulnerable? Let me give you some examples. The 66-year-old, the 21-year-old, or the 13-month-old. Who's most vulnerable?
The 13-month-old.
Okay. Yes. And so, like I said, we are elderly and our children. But if we had to choose between the two, it's going to be that child, because they solely are going to be reliant on a parent or guardian providing that care. But nevertheless, any set of person can become vulnerable. I often bring up the storm. A storm come through, it can leave a community unhoused. Before the storm, they had housing. But because after the storm, there was strong winds, roofs were blown off. That community, the people that lived in that home, now they're unhoused. Now they're vulnerable. How many years has it been now? Probably about 3 or 4 when Ozempic came about. Who was the vulnerable population at that moment in time when we realized that Ozempic can be used for more than what it was originally designed for? What population of people were vulnerable?
Like elderly.
The diabetics.
The diabetics.
Oh,
Why?
diabetics, yeah.
Because I don't know if you all heard about it, but because they realize, and medications, they're made for one thing, they're designed, but there's so many off-label uses for medicines now, and people are they're embracing them. Healthcare providers are embracing them because they realize, hey, we can also give this for that. And so once they found out that it assisted with the weight loss, so people were being prescribed the Ozempic, but they were not diabetics, which the people that were diabetic is why it was really designed. And what was happening, people were going to the pharmacy to get their refills, and they couldn't get them because people that were using for weight loss were outnumbering, or I guess was getting their prescriptions filled first. But the diabetics became a vulnerable population, specifically those that use that to control and assist them in their own care. So, what level of care is that? A person taking Ozempic, what level of care is that?
Tertiary.
Tertiary, exactly. So I'm just trying to mix it in. So no matter how you see it, how it comes out, that you make sure we got it. So vulnerable populations is the people that we're treating, that we're taking care of. And generally, we think about the elderly and the young, but any population, a community can become vulnerable. Depends on what's going on in that environment. And then, so community venues where we practice at. We can practice during COVID. We were our place of practice was outside. People were receiving healthcare in their vehicles. They didn't even have to get up. And you all might have even worked and administered some vaccinations or did some testing, swabbing. Where did it happen at? It happened outside. There were makeshift urgent cares. Communities had tents and people were working out of tents. But nevertheless, it's where you work at. And it could be in the person's home, it can be the urgent care, it can be the place of worship, because we do see places of faith and worship, they are expanding. They have daycares and they have all these different programs that they're offering. They have even a link with the homeschooling. They can be their testing side or whatever. But because of that, also there is where healthcare can be provided. And then we have the rules of practice, what's guiding how we practice. But we go back to that State Nurse Practice Act. It keeps the public protected. And how it does that is defines what our do's and don'ts are as a healthcare provider. So rural access barrier. So here we have some outcomes of someone living in a rural area. They may have poor health behaviors. Wonder why? What is it about? Does it have anything to do with this person living in a rural community? Incomplete perceptions of health. Why is that? Limited resources to support personnel facilities. Because what is it about a rural area that a person might have poor health behaviors?
No accessibility.
Okay, so let's translate that into what? Give me an example. They may not have access to what?
Transportation.
Transportation to even get to the doctor. And if it's a specialist and the specialist is in a neighboring town, not in their town, how are they going to get there? Okay, what's another one? What about we're asking people to my plate? We're asking people to choose healthier food options. What is it
Like-
about some rural areas with healthy food options?
They're not available.
They're just not available. Exactly. They don't have farmers markets. It might just be one grocery store, and it might be one of the smaller chain stores that might sell some fresh fruits and vegetables, but it's just not available. And because the area is so spread out, and so it hasn't been developed, and those things are just not there. So I don't want to say something as simple as getting an eye exam. It just might not be doable in an area where someone lives if it's rural, because it might not just be an eye doctor in that area because of the smaller populations. Things are so spread out. Healthcare providers tend not to come to those areas. And as a result of that, resources and opportunities to take care of myself is limited. And what does that lead to? It leads to poor health behavior. You know, it's rarely that a person doesn't want to take care of themselves, but the thing is, most of the time, it is those barriers, not having access to something as simple as, and I want to say simple, a fresh fruit and vegetable. Okay. So the mobile workforce, agricultural labor, we have migrant farm workers, and we do have seasonal farm workers. The migrant farm workers, they travel during those seasonal times. For example, in one area, there's a whole, there's a peach orchard. As far as you can see, you see peach trees, peach trees, peach trees. But think about it. Peaches only are picked a certain time of year. So would that farmer need that staff the entire year? No, they're not. So they just need time. I mean, people to pick it when those peaches or whatever it is, when they're ready to be gathered and harvested. And so what could potentially happen to those workers while they're there picking and harvesting all the different crops? What could potentially happen? So what we're finding out now is that most of them use some type of pesticides. You do have some farms that are not using those chemicals to help raise their crops and things. But if those workers are day in and day out and they're exposed to those pesticides, we do want to teach them to, when they go home, when they return back to their temporary housing, that they need to handle those clothes appropriately. They don't need to just go on in the house and sit on the couch. They don't need to hold their child. They need to remove those clothing, everything from the top to the bottom. Because if they're wherever they were working at was freshly, pesticides were put out that day or continuously put out, and even if it was put out and it wasn't put out anymore that week, still because of them actually having that direct contact with those fruits and vegetables, it puts them at risk, and things get on people's clothing and everything. So we do want to teach them to, I may have a question up here. We do want to teach them to, okay, that's fine. And yes, and I didn't announce that earlier. All these sessions are recorded to you all and they're viewed by the attendance administrator. So if you're having to walk away from the camera, make sure you're putting a reason in the chat to myself. You don't have to send it out to everyone, and make sure, just put a reason why. Good. And we can push on through if we're okay. We can take our break at the end. So that doesn't mean we get out of class early. It just means that, at that moment in time, we take our break and, the class ends. So, but yes, so you want to think about their, the things that they might be exposed to. We want to educate, have those conversations. Hey, when you go home, you need to disrobe, take those things off. Okay. So we talked about culture being culturally competent, I think on the first week, I believe, but it goes for all of your courses that you're taking, no matter what setting you're in. We need to be culturally competent because that helps us to identify and provide that best care for our clients. So while we are listening, while we're gathering that data, doing our assessment, the clients are sharing information with us. We want to make note of those nonverbal and verbal things that they are saying. And then if we've established that therapeutic relationship, then our clients are more apt to tell us things that are going on. And they will let us know, hey, if touch is appropriate or not, if sustained eye contact is appropriate or not. So that helps us to provide that culturally competent care. So there's a cycle that say the cycle of poverty and being unhoused. So I'm going to take the time to read this right here. So higher infant morbidity, lower life expectancy, and lack of transportation. So what does that have to do with anything? Well, if I don't have money to purchase the vehicle, even if I purchase a vehicle, I have to keep it up, right? Oil change, have to put gas in it. Even if there's public transportation and I don't have enough funds to get on the public transportation to go to these places that I need, to the doctor's office, to go to the farmer's market, then that can negatively impact my care. And then my whole being. And think about if a person has diabetes or asthma or any of these and their medications, if they don't have the insurance, well, they might qualify for, because of the low income, they might qualify for those resources. But then those resources are only a certain amount, depending on what state you're in. And that's why when you go to some states, people be like, well, I have this resource available. And I forget which act did that. But anywho, states have the choice to decide to get those funds. And so that's why you go to some states and the resources available, and then another state is not available because the state itself couldn't afford it, but then they decide not to receive the monies from the federal government to pay for that resource to offer it to the people that live there. So we want to keep in mind living conditions if someone is unhoused, keep those crowded conditions in those shelters and things like that. You want to make sure in the event that someone has, for example, tuberculosis and there's a crowded conditions, if that person has it in a shelter, the rates of it being spread are high because it's limited amount of space. And then how does tuberculosis spread? How does it spread? By touch, airborne. How does it spread?
Airborne.
Exactly. So you want to step back and look at the whole picture. Well, what is this tuberculosis? What happens? How does someone get it? Let me look at my environment. So make sure we are looking at the environment as we are deciding what's appropriate and things that put our patients at risk. And our patients could be in the shelter. We have different settings. So remember, this is the community. So vulnerability at extremes. We do have teen pregnancy context of significant concern due to the generational cycle of poverty. Federal legislation from 1975 prohibits schools from excluding pregnant students from attending. And what that has done is it has decreased the dropout rates. Of course, that child will have an individualized education plan. That child, they have a variety of options now for the child to complete their education. Because that, we want to allow time for that child to still complete their education. Because studies have shown that if a person completes their education, at least their high school diploma, then that lessens the chance of them living in poverty. And then it lessens the chance of them not being able to move on and be able to provide for themselves. So harm reduction, the logic of harm reduction. Let's look, make sure we look at this model. There are all these different models out there, you all, but in which the models are to help you think about the care that you're going to provide, but you're going to consider the setting, the patients, and what's going on with them. So here we go. We have the harm reduction activation model. So in the intervention phase, nurses provide education on, for example, cleaning needles with bleach or safe disposal and preventing blood exposure. Okay, so the whole thing is harm reduction. So the primary outcome, needle exchange programs dramatically decrease the community spread of bloodborne viruses. It's like, well, why would we be giving needles so people can use them to abuse substances? Well, what else other than a person abusing substances? If they share needles, what is happening? There's an increased risk for bloodborne viruses being spread. So we're not saying that we're not going to work on or assist or provide resources to help the individuals stop using their substances, but while they're using them, we want them to be as safe as possible. So you did see, and they still do have needle exchange programs, and that's where people that use the substances and they need the needle to inject, they they provide it for them. So what is the benefit? So do not increase injection of drug abuse. So prove that these programs do not increase the injection of drug abuse. So what they're saying is like, why don't we give them needles? The studies have shown, because we're providing the needles so that we can prevent the bloodborne viruses, it does not mean that we are promoting for people to abuse substances. As a matter of fact, it doesn't show that there's an increase in drug abuse. So the secondary outcome, trust is established, leading to a measurable increase in the number of individuals entering formal treatment programs because we have provided this needle exchange for them. Because the whole thing is we don't want them to be a spread of bloodborne viruses. That, like, wow, you care enough about me, even though you know that I am abusing drugs, you're providing these needles for me so that I don't acquire a bloodborne virus. That person is more apt because it shows that you have that concern for that human. They're more apt to say, well, hey, I need to try to get off these drugs. Do y'all have a program that can help? And then that's like a secondary outcome. And then that also, what comes to mind is what's the things that they have? The policemen have it now. I think it's in like courthouses for people that OD on what kind of substance it is. I can't think of it right now. But the injection that it's not Narcan. What is it they have that they can provide?
It's Narcan
It
for
is Narcan.
opioids.
It is Narcan, yes. So that, not that we're promoting people to use substances, but there's a high rate of overdoses. And so this is available to emergency personnel. Like I said, a lot of towns and things, they have it available at like their city halls and things like that. And people are trained. And so in what they're in hopes of decreasing the people of that OD, and also in hopes that people reach out and say, hey, I need help with this substance abuse problem that I have. Is there another resource? Because I don't want to OD. I need to do differently. So it's like a kind of a dual, it should have a dual effect. Usually it does. But like I said, it does show that, we do have a genuine interest in our community, our patients. Even though they're in the community, they still are our patients. So the ANA mandate, defined as a specialized professional practice focusing on intentional care and thinking about the entire person. We're thinking about their health, the care of their spirit. In the event that they have an illness, they're sick, we're thinking about that entire person within the faith community. So we can be that parish nurse. Do you have anybody rotated through and rotated during their clinicals with the parish nurse? If anybody had the opportunity of doing that? No one. Okay.
No.
No. Okay. So the holistic scope relates to the dynamic relationship between body, mind, and spirit. It goes beyond physical symptoms to observe and care for the entire patient in a changing environment. So just like the storm comes through, we have patients that might be diabetic or whatever, but then also they're needing somewhere to stay. So we're addressing everything. So that's why a lot of facilities, they are partnered with the Red Cross. I don't know that the Red Cross specifically hires a nurse, but nurses can be volunteers with the Red Cross. And so that will, in the event that there's inclement weather, storms, and things like that, we go into the community. Another thing, I know another, I can't think of the program that they have right now, but it's where they come and install fire alarms in your home. And with that program, it is dual, it's harm reduction fold, that it follows that model. What it does is what they found out, that people are having fires and people don't have fire alarms. Had the fire alarms alerted people, there would be less loss of life or less injuries because people would get out in time because they would be informed. In addition to that, they have partnered with, in the areas the Red Cross they have their fire alarm program, but then they have it um, where they partner with male organizations with youth groups. And so what they do is they get together, because the Red Cross, the way their program is written up, the Red Cross goes in and install these fire alarms. So they actually come into your house. You just let them in. They don't, you don't have to install it. So think about the impact of that. If we have, we're giving youth something else to do. We're giving them a skill set. We're working on soft skills because they're having to work with an adult. At the same time, we're working on those hard skills. They're learning how to be on the team. And I don't know if you looked at or installed a fire alarm, but they're not easy. At least I don't think they're easy to install. But just think about the impact of that, the reduction of harm. So that child there would be an increased chance of that child going on to give back to the community. They may even think, well, hey, if I can install this, I can make, they may be interested in being a plumber and all these mechanics and all these different things. So that's that model. So targeted interventions in faith nursing. And it's just in that place of faith. So let's look at these right here, because remember I said that these interventions are big on all the exams. So we're looking at it in reference to faith nursing. Okay. So primary, we said we're preventing. So some examples, we're going to take the time to read through all of these right here. Encouraging active group interests, providing healthy snacks for older adults, initiating a walk to Emmaus programs. Not sure what that is, but in the area, I just met a young man the other day where he has implemented a walking program. So on the first and third Saturday, at whatever time what time it is, there is if there's a park in your area, if you can't go to the park, he's advocating for you to get out in your yard or your space and walk on the first and third Saturdays. So he's encouraging people to, you don't have to have a gym membership, public park, your home, your yard. And so with that, he was in hopes of just having people more healthy, implementing more physical activity. Because everybody can't run, jump, and hop and play the pickleball and tennis and all of that. So he said, well, hey, just what about walking? So he's just advertising everywhere in the community. You don't have to come to the park. You can use your yard. And so that's primary prevention. So secondary prevention. He said screening. We're trying to detect or determine if there's something there. So conducting post-hospitalization home assessments. Okay, so going to the home and seeing if there are, some safety issues so that we can prevent this person from falling or something like that. So just going in and assessing that home, identifying fall risks, eliminating throw rugs, moving heat sources and oxygen, just clearing the clutter. Throw rugs is a big one. They don't have that non-slip padding on there. Those things you'll end up falling because you'll step and they just slide. And then using attitudinal risk surveys. So going and gathering that information. Tertiary, and we're talking about faith nursing. Some examples are collaborating with the ministers on weight stress management. So if someone's been diagnosed with being overweight or obese, then we're collaborating with those persons of those leaders in those faith communities to see what programs can we implement in their settings. And then following up on provider care for chronic diseases and leading mental health support groups. So if someone has some type of mental illness, it could be anxiety, whatever, creating a support group. And a lot of times people do, and you don't, for the most part, you don't have to belong to that place of faith in order to participate in the different programs that they actually have. And they usually have for children all the way to the older adult. Okay. Home health and the end of life. So we have hospice and palliative care. Now, so what is it? Hospice care, what would that conversation be like if you were telling a family member that explain to them that their loved one qualified for hospice? What would you be telling them about hospice? And well, tell them a little bit more about hospice. Why does my loved one qualify for hospice? That's the question they're asking the nurse. What might that nurse say?
They have to be terminally ill and they have
Exactly.
6 months or less to live.
Exactly.
And they're not prolonging life. They just concentrate on the quality
mhm.
of life, and they don't have like the prolonged treatments anymore. They just kind of, unfortunately, just do quality of whatever time they have left. Pain
So with that
management.
being said, let me interrupt you for just a moment with that, which what you just said. Would a person that's on hospice get routine lab work done?
Yes.
Tell me what you, okay, tell me again. Why, how would it, the question was the family member asked you, well, why does my family member, how do they qualify for hospice? Now, what would you tell them now? Start over again.
They have to be terminally ill,
Terminally ill. Keep going.
6 months or less to live.
6 months or less to live. Okay.
They're not going to have prolonged measurements.
They're not going to have prolonged measurements.
Yes.
So my question to you
Pain
again
management.
is, what you say?
Pain management.
Pain management. So my question to you again is, would they do routine lab work on a person? It's like, we go into the doctor's office, they always want to draw out with a CMP.
No, they probably will not.
Because why are they doing those tests? They're trying to see if what your levels are
Improving,
normal.
but they're not going to be improving.
Exactly. So I'm glad we walked through that, because that's what I mean about applying what you know. So you were calling out all the things about hospital. That's correct. You're deemed terminally ill. And so, comfort is like a biggie on that. And so then I gave you a question. So that's an example of how we want you to apply what you know. So go back to what you know now, because you knew what hospice was. You were telling me and telling me. And so that's why I said, if you want to use that dry erase board to gather your thoughts, then do that, because that's how we're missing those questions. Like, okay, well, yeah, we would do labs on everybody. Well, would we? Based on hospice guidelines, is reason why they, because hospice does what? It excludes curative treatments. Now, I've seen people on hospice for longer than 6 months. I've seen people go on hospice, come off of hospice. So, we don't want to give false reassurance, but you just never know. No one knows when someone's going to actually pass away or anything, but these are the qualifications. It excludes actually curative care. Home health nursing promotes well-being within the patient's community. Watching our time here. To qualify for Medicare reimbursements, agencies must prove necessity of skilled nursing care. So how is that facility going to prove necessity of skilled nursing care? How is that long-term care facility or any facility going to prove the necessity of skilled nursing care? How do we prove that?
Therapy.
You said therapy?
Yeah, the therapy that they get, and the documentation from the nurses on their ADLs.
Got it. That documentation about everything that we do for that patient from A to Z. That's what they do. And that's I don't know if you all thought about it, but you can also be a Medicaid, Medicare nurse or whatever. And what they do is they look at the documentation, they sift through those charts. So the facility sends in their bill. They look through those charts and say, nothing's documented about skilled nursing care that this patient received, or they did document wound care was done on what's today, July 30th at 8 a.m. This patient had a finger stick at 10 a.m. and it was documentation. That documentation is going to prove whether or not this, because remember, if it's not written, they said it didn't happen, right? So taking the time to document. And if it's not there, guess what they do? They don't reimburse those facilities. They say, hey, we don't have enough proof that show that indicates skilled nursing care was provided.
My friends after school, you could.
Uh-oh. They say that. And so that document, taking the time to document is so important. Okay. So we started talking about the WHO last couple of weeks, but the World Health Organization provides worldwide disease monitoring, publishing international causes and diseases and death, monitors adverse drug reactions. And so, we're supposed to ask our patients to sit and wait, if we administer a vaccine or something, if it's an outpatient setting. And even if we administer in the hospital or the nursing home, we're supposed to document those drug reactions. And in the event the patient does, all those things are reported. So who keeps up with them? And they determine like, well, hey, I forget the name of this medicine. It was a medicine that was, because we do have the FDA. They're supposed to drug companies, pharmaceuticals, medical supplies, all of these things like stents. And when I say medical supplies, they're supposed to put the stamp on and say, hey, these things are safe for people to use. It's safe for the doctor to insert this stent inside this person's body. It's safe for
The FDA?
Food and Drug Administration. Yes, they do. Foods, drugs, and medical equipment. I know they did make the name, it didn't make the title, but it actually oversees the medical devices. And so, if a person's having drug reactions, these things should be reported and documented and reported. And so, with the WHO sits back, they look back and say, well, hey, we're having a high number of people that are having poor outcomes that have received a stent. And they look back and see, what those stents were, who manufactured them, where they actually made them at, which areas receive those things. They have to look at all of that to determine, well, hey, do we need to pull these things off the market and stop using them, or are they safe to be used? So yeah, here. So the federal level, agencies such as the United States Department of Health and Human Services administer and regulate national health policies. And then on the state level, they have laws to protect the health, safety, and welfare of the people that live in those areas. State Board of Nursing, let's see what they do. So the question came up, not in this class, but another class. Ooh, this class is so long. Well, the Board of Nursing, one of the things they do, they look at these programs and they see the amount of time that you're supposed to be in the programs. And so they determine, well, hey, we need this amount of clinical, we need this amount of simulation. So that's all. And that's why you can have certain classes, you have these amount of minutes, classes for this amount of minutes. But what else does the State Board of Nursing do? They were established by state legislation. They're composed both of nurses and civilian consumers. So you can actually, and they usually are volunteer positions. So they have a few paid positions, but you can actually be on your state's Board of Nursing. And it looks at the licensure, the examination, approval of nursing schools, in writing regulations, they actually also look at when there are grievances or complaints filed. They're the ones that oversee the revocation or taking or suspension of licenses as well. But protecting the public is the thing. That's the whole, and they define and tell us what we can do and what we shouldn't be doing. Okay, so let's look at this malpractice. We have a duty, breach, causation, and damages. So what is that talking about? You've been assigned a patient. So be careful if, some settings, like in the hospital setting, sometimes we'll get admissions. And so our assignments will change. Our patients will be discharged. You may be pulled to a different floor and things like that. Because for the most part, that's how those facilities actually ensure that the patients are taken care of. So you'll be cross-trained and you'll have your main floor, but sometimes you're pulled to wherever there's a need. So in the event that happens, you want to ensure that your change of assignment actually changes as well. Because in the event that something happens and they look and see that that patient was assigned to you, that means a nurse owed a duty to that client and was directly responsible for their care. So I was like to make sure that I have to change assignment. I need you all to change it. Make sure it's in the system that I'm this patient. I'm no longer owed this client to provide care for them. Because if in the event that something happens, a nurse failed to act in a way that a reasonable, prudent nurse would under the same or similar circumstances. So we assign to this patient, the care plan tells us what we need to do because it's individualized, how to take care of this patient. It might say vital signs every 8 hours. It might say administer whatever medication, 2 persons assist, whatever that care plan says. In the event that we fail to act according to how that care plan has outlined for us to take care of that patient, and if that patient has some type of injury, what they're going to do is say, hey, was a nurse assigned? What was supposed to have been done? Did it not occur or did it occur? In the event that it did not occur, that means there was a breach. Now then they say, well, hey, the patient sustained, we'll just say a broken hip. The patient sustained a broken hip. Now, based on the circumstances, is there a connection or relation, or is it the reason why this patient broke their hip? And if there's a connection there, that means that we have been negligent in providing the best care for that client. So am I responsible for this client? What am I supposed to be doing to take care of this client? Am I doing? And so that's why it's so important to see it through to the evaluation part, to collaborate with the LP and RN, collaborate with, hey, we went in, we did the dressing change. This wound, the measurements, this wound is getting larger. This wound is improving. So that's why it's important, because sometimes we need to change what those interventions are. And so in the event that, because sometimes the interventions are just not good for that client. I go back to wound care. Sometimes if the wound is getting worse, how will we know? Those measurements, because the wound is supposed to get smaller. Sometimes they have to change to different medications. Sometimes we have to change the amount that wound is changed. So that's why you want to work it all the way through the evaluation phase, because in the event that patient wound doesn't heal and the family decides to sue or something, they're going to look back and say, well, hey, what evidence showed that this wound was healing? First of all, what do we do to prevent it? To prevent this person from getting that wound if it's a in-facility or in-house wound. It's different if the patient comes in and they already have it. But in the event that patient is in that room and they don't have any wounds or open areas on their skin, and if we follow that care plan, but if we didn't document it, they're going to look and say, not documented. This patient was turned, repositioned. Looks like they were not eating. That wasn't addressed. They look at all of those things. And then if in the event that they say that we didn't follow through, then we're negligent. Can't get away from assessment, ADAPI, gathering all that information. What is subjective data?
What the
information.
patient says.
Exactly. Thank you, Ms. Hunt. It's what the patient says. Now, but then, for example, if the patient says, oh, I'm hurting 10 out of 10, we document what the patient says, but we also document our observations. Patient has facial grimacing, which is objective data. Patient is crying, they're guarding, or patient is laughing, or patient is continuing on with regular routine activities. We still want to add that information. We want to document both what the patient says and also what we actually observe. So assessment, we're identifying cultural needs. Think about the setting that this person is in. These migrant health workers, they are in the fields exposed to the pesticides. Think about their living conditions. Are they crowded? Because remember, they're just coming for that moment in time to complete the task. And then they're going on back home. So a lot of times those the owners, the farmers, the housing might not be up to par that these individuals are living in. So we want to keep that in mind when we are gathering information. Hey, where are you living at? Are you the only one that lives there? Do you have running water? A lot of times those places are not, like I said, are kind of unkept because they only need them for that short amount of time, harvesting time. All right. And so then we have the diagnosis. Then we have planning and implementation. This is our doing part. And then evaluation. Ensuring outcomes align with legal parameters, nurses must constantly evaluate ethical boundaries and maintaining deep familiarity with living wills, power of attorneys. I think they just ask you that now when you go into pretty much every facility. Hey, do you have a living will? And if you don't, would you like to execute one? Almost finished here, you all. Well, let's just review back. Here, let me do from slideshow from the beginning. So we talked about OSHA, the Occupational Safety and Health Act. The whole purpose is to ensure that we are safe while we're working. Safe and healthful working conditions. OSHA ensures occupational health standards. Its mission is not to have an inspection system, but is an entity that ensures that they can come in. You can report, especially if you reported that mat was broken or your equipment is broken and they're not fixing that. OSHA is there. In the event that you fall or have some type of injury on your job, you need to be reporting that because you never know in the long term how that injury is going to affect you. So make sure you're reporting it before you leave, before you clock out. Because some facilities is saying after you clock out you're no longer on the job and you should have reported it before then. So just ask that question. In the event, they usually go over all of that though, but make sure you write it down, make note of how that happens. And hopefully nothing happens while you're there. But in short, to ensure safe and healthful working conditions, that's OSHA. Addressing diverse workplace hazards requires conducting comprehensive hazard assessments. If you're at that industry working, for example, at the car making manufactory or the shoestring factory, and you're seeing several of the employees coming in, they're having similar injuries, we might want to go to that work area, especially if they're coming from the same work area. It might be something that's in that area that's not conducive for the work to be completed without causing a person any harm. So we want to go and visit that work area. We want to see if there is any commonalities. What were you doing when this happened? Because usually in those places, there's a process. And I'm trying to think of, like, we used to have to package, like, I don't even think they make CDs anymore, do they? Or those movies, but we used to have to package those things. And along the process, you had to do, depends on where you were on the line, you had to do certain things. So if we're seeing employees come in and we want to ask, well, hey, what station are you working in? We want to look at it. And then what were you doing in the part of your process when this injury actually occurred? Because it could be that that equipment is malfunctioning, and it could be that the process to whatever they're doing needs to be changed, especially if you're seeing a huge number of injuries coming from that area. Addressing diverse workplace hazards requires conducting comprehensive hazard assessments for all types of hazards, including biological, psychological, and physical factors. So we're going out, we're looking. What is the working condition? Is there a mat there? Is there supposed to be a mat there? Is this equipment broken? This ensures a holistic approach to workplace safety and risk management. Primary prevention is directed toward promoting health and averting the problem from ever happening anyways. Like the guy that's doing the walking club on the first and third Saturdays. Hey, you can come to the park, you can walk in your yard, or you can make sure that you get up and go to the gym that day. He's putting it out there, hopes to increase physical activity. And we know that increasing physical activity can lead to decrease or reduction in a number of things. So primary prevention is attempting to avoid or prevent harm, prevent an injury, or prevent a chronic disease process. Education. So some examples is providing safe equipment, scheduling routine break sessions, and offering healthy snacks are a primary level prevention of interventions. Decreasing air pollution, decreasing noise pollution. Are the employees wearing their earplugs so that we can prevent hearing loss? Do they even know what the earplug is? Do they know how to wear it? Providing that education about that. Secondary prevention involves screening for the disease or detecting the disease at its earliest stage possible. We want to advocate for certain testing types. For example, lead testing, especially if we know that the patient have lived in a home or been exposed to paint that is before, I think it's 1950. But anyways, that paint has lead in it. Before, the lead was an additive in pretty much everything until we found out that it was not safe for humans. So another type of testing would be A1C testing. See what those sugars were. See if that sugar been maintained over the past 3 months, especially in high-risk populations. It is crucial in identifying exposures early so that we can hopefully prevent this person from actually going on developing diabetes. If we tell them, hey, your A1C is getting close to this being abnormal, we can go ahead and start, recommending some resources, the gym, some nutrition information, and the whole sorts of things. This intervention allows for timely interventions and reduces the long-term health effects. Tertiary, we said it aims at rehabilitation and restoring the client to the highest possible level of functioning. Some examples is implement education on glucose monitoring. This client has diabetes, how to monitor, going over that sliding scale. A person has hypertension, self blood pressure measurements, looking at what those numbers actually mean. Okay, so we haven't taken our break, so we have about 3 or 4 more minutes left before we can officially start. So are there any questions about any of this content? I'll stop right here to take questions, and then I'll finish these slides on out. Any questions? Make sure it's not any in the chat here. All right, let's go on and finish. We talked about the triangle, the pathogen. It is what is making people sick. That thing that was on the lettuce, cyclospore. Am I saying that right? It could be that virus, that bacteria, whatever it is, that's making people sick. And then the host is the individual. The environment of the conditions that facilitate disease transmission. Understanding these factors helps in identifying the source of the outbreak and implementing appropriate control measures. So the nurse identifies multiple potential environmental risks. They look at the lead, the water, food, affecting individuals and their community. When they first said they had an increase in number of people having explosive diarrhea, what is this coming from? So they went back and looked at everything from A to Z. They looked at environmental risks. Priority interventions focuses on reducing exposure sources, educating residents, and collaborating with public health agencies to address public level risks. So collaborating with environmental agencies is essential in monitoring hazardous waste levels and implementing mitigation measures to reduce health risks. I want to say it was a couple of years ago, it seems like trains were derailing, and all the trains that were derailing, I know this is not all, but it just seems like all the ones that were derailing had some type of chemical on it. So what did that mean for the people that live in those areas where those trains were derailing and those chemicals were being spilled out of those containers? That put them at risk for being exposed to those hazardous materials. And then what's the long-term effect of being exposed to those hazardous materials? In the event that that train derailed near a waterway, a pond or a lake, where the water source come from, in the event that there is a industry that emits all this air pollution, what's the long-term effect of that? I think it was someone in this class that mentioned the fires in Canada, how that smoke is being spread throughout the states. And in some areas, they were asking people to stay inside, and if you don't go outside, if you don't have to, and then if you do, wear your mask. And if you were exposed to that, people were experiencing, where they were having to go to the hospital to receive some type of respiratory care. What is the long term of that? So we do want to implement measures in hopes that those fires don't start, in hopes that trains don't derail and things like that. This approach promotes community safety and addresses environmental health concerns. So a lot of times, people they just think about the individual, but what about where I live, where I stay, where I work? Are those environments safe? Reducing the risk of contamination, it ensures safe food handling practices. When should I be washing my hands? When should, before and after care, before and after administering medication, any type of contact, we want to make sure that we're implementing those hand hygiene protocols as they're supposed to. So this right here, I kind of already talked about assessing the issue, forest fires, noise pollution. It is crucial in understanding the source, because therefore you can backtrack and come up with a solution. Advocating for reduction policies and promoting alternative methods can help reduce blank and improve the quality in the community. What can it help reduce? Chronic diseases, injuries. It can reduce exposures to hazardous waste, all of the above. So who is at highest risk for illnesses? We said that the vulnerable populations is someone, so with the smoke coming across, someone that has any respiratory disorder, that would further exacerbate their condition. The potential is there. We talked about congregations, places of faith. This is where the nurse will provide that care. And the nurse is accountable to the congregation and its governing body. They do have nurses on site. Like I said, places of faith offer so many different resources now. So they have the daycares, they have youth programs, they have adult programs. So a lot of them actually hire a nurse. And so you're pretty much autonomous because you're in that place, pretty much by yourself. So you're maintaining and thinking everything through. This is just showing the different, okay. So we haven't taken our breaks. I'm going to pause here and stop and take any questions. And I think I have 2 more slides to go over, and I can continue to go over those. But if you don't have any questions, feel free to log off, because this is your break time, and we'll see you on next week. But I'm going to finish these other 2, 3 slides if you don't have any questions. Oh, there's just 1 slide left. Any questions? All right, you're free to go because you're on your break, you all. Because we didn't take an official break. All right, so I'm gonna go ahead and finish this 1 last slide here. And from current slide. So we do have the Agency of Healthcare Research and Quality. It is responsible for improving quality and safety of healthcare through measuring quality indicators. So this is where they come in and they have certain things like the number of falls, the number of medication errors. They look at all of that to determine whether or not this facility is providing the best care that they can. We talked about the CDC, Centers for Disease Control and Prevention. It's responsible for monitoring health, detecting problems, and implementing preventative strategies. The National Institutes of Health all things research. So qualitative and quantitative, they are the ones that oversee research, the National Institutes of Health. So we have the Health Resources and Services Administration. It improves health status by providing education and funding for the healthcare professionals. So they're strictly making sure that the healthcare provider has all the tools that they need. So that's why you will see them having like simulations. And you can, once you get your license, and some of you already know this because you're already nurses, with that continuing education unit, you can take part in, a lot of facilities offer like these extra classes where you can go in and gain more knowledge and skill set. You can add and get those certifications that you need as well. All right. And that was it. So you all take care. We'll see you on next week. Make sure you look at this recording, you all. As I mentioned earlier about the Red Cross partnering, well, actually providing fire alarms and bringing in the adults and the children. They kind of created a program, and what they found out is partnering with associations like the Red Cross that provides alternative activities, and with those activities, it improves social skills. Because think about it, the adult and the child, they're having to go into someone's home, so they're having to talk to people that they don't know, introduce themselves, and then think about they're having to um, learn how to or install the fire alarm. That's going to require reading instructions. That's going to require asking questions if they have questions. And so what they found is partner with associations, like the Red Cross example was what I gave. It provides alternative activities. And what it does is it improves those social skills. Poverty continues to be a problem in rural areas. The group that's highest at risk, we talked about it earlier, are the children. The children are higher risk because we always say that our young and old, they're the ones that are at increased risk, but the ones that has the highest risk are the children because they will solely rely on an adult to take an adult or parent or guardian to take care of them. So clients that live in rural areas, because those areas are not wildly populated, pretty much everyone knows everyone in those communities. So there would be a lack of anonymity in those areas because everybody knows everybody. So it's going to, and as a result of that, reporting certain things, domestic violence, even just going and seeking care, there may be limitations in a person actually seeking out that care because they're afraid of that they go to the doctor's office, that person's relative might work in there, a friend, and the communities are so small. So the lack of anonymity among rural communities would make reporting health issues more challenging because people are more than likely going to be afraid to report because they think that someone's going to find out their business, so to speak, find out their information. So lack of transportation and limited healthcare facilities are common barriers in rural communities. So collaborating with community resources to provide mobile healthcare services helps address this barrier and improve access to the care for residents. So we said lack of transportation, limited healthcare facilities. Some areas don't even have an urgent care, might not even have a hospital there. These are barriers. So collaborating and finding out what resources are available in that community can improve the access to care for residents. And you see now that there's a lot of mobile healthcare services being provided. They're going to the people. In addition to that, you do see like the specialty providers, they're actually going in, coming to the rural areas maybe like once a month. So because they do know that it is a barrier for those patients to travel to that neighboring town. So in the event that a specialty doctor comes down and they have appointments available once or twice a month, how they're going to know whether or not so that is a way of overcoming that barrier of that patient, that barrier of transportation, so that the healthcare provider is going to come to their area. But how are they going to know whether or not that doctor coming down to that area or going to that area is really doing any good or is effective? So what they can do is just track the number of patients or the utilization of that mobile healthcare services and the community outreach programs. And then they can determine, well, hey, this doctor comes on Mondays, the first Thursdays of the month. How many patients did they actually see? So are the patients utilizing those mobile healthcare services? So tracking that, looking at the numbers will help determine whether or not those services are being utilized. So we know that migrant farm workers, they're spend most of their time bending or lifting, and so they think about what body system would mostly be affected if they're bending and lifting all the time. That musculoskeletal system. So they may complain of back pain, knee joint pain, and so it can come from harvesting crops 12 to 14 days. I mean, having working 12 to 14 hours. Because think about it, they're going to harvest crops just at that moment in time. They're not going to be harvesting crops, for example, peaches. They're not going to be pulling peaches from the trees for the whole 12 months. So therefore, they're going to work extended hours just to make sure that no peaches are lost. So that's going to take a toll on that musculoskeletal system. And so, because they're bending, lifting, reaching. And so, as we're doing an assessment, we can ask the clients, hey, what makes your pain gets worse or what aggravates it? And more than likely, they're going to say that bending or lifting because they do those repetitive motions over and over again. The health status of rural community, you do see an increased number of chronic illnesses. Clients in rural communities have an overall decrease in health status when compared to urban clients. So as a result of that decrease in health status, that equals an increase in chronic diseases. We do want to teach our migrant farm workers about the exposures to pesticides. We want to tell them how to reduce their exposure and their family members' exposures as well to those pesticides. When we talked about making sure that they take those clothing off, that they first of all wear the protective gear that has been provided for them. Most people that are uninsured or unhoused or homeless will receive their health care in the hospital emergency rooms because more than likely they can't subscribe or are not subscribing to the insurance, that payer source. So hospitals generally do not turn people away. And so therefore you will see where those patients will receive their health care in the hospitals, because think about it, they're in that doctor's office, they can't go past that desk until they make that copay or either pay for that visit. So the hospitals don't turn them away. So most care of unhoused or homeless people will actually take place in the hospital setting in that emergency room. We talked about that teen, that single mother, that child. We want to ensure that there are programs in place that allows that teen mother to complete their education, because it is shown that if that child completes their education, they're more likely to be providers for themselves and their baby. drug screen. We talk about the levels of prevention. Primary, secondary, and tertiary. Primary, we're preventing, we're providing that education. Secondary, we're screening. We're trying to detect, determine if there is a disease process, if there's an injury, even if we're trying to, if someone administers a drug test, we're trying to detect or determine whether or not this person is using drugs. So that screening test is secondary. July is mental health month. And so mental health education and stress management workshops, they are considered primary prevention. And we're promoting mental wellness, and that will build resilience and prevent the onset of mental health disorders in the community. So offering mental health education and stress management workshops, that's an example of primary prevention. Providing the education and attempt to prevent, that's primary.